class. I'm Christian Akpata. I'll be taking the course for forensic nursing, NSC 417. So during the course of this lecture, if you have any question or concerns, feel free to send your questions to me on my email. Forensic nursing is the application of nursing science to public or legal proceedings in collection, identification, analysis, and interpretation of evidence collected during criminal investigations. Nurses are increasingly building professional relationship with police to assist them in collection, preservation of evidences, and this increases the responsibility of nurses to understand the right of both their victim, of both the victim and the suspect, and also to be aware of the local, state, and federal laws which are related to crime reporting and evidence collection. When nursing practice interfaces with the law, we call this forensic nursing, and the patient is considered a forensic patient. It originated in the year 1992. Forensic nursing was officially accepted in 1995, and the specialty was formed. Virginia A. Lynch in the year 2002 developed a conceptual model which was named the Integrated Practice Model. There is need for ethics and morality in forensic nursing. And the need for ethics and forensic nursing is to ensure there is appropriate conduct and equity for the suspect and victim of crime. What are the key aspects where ethics is needed? It is needed in the issues of dual loyalty. Forensic nurses need to balance the need to ensure ethical nursing practice and also their role in the justice system. There is need for balance in privacy and maintaining of confidentiality of patient. There is the need to navigate issues of patients with non-adherence, resource allocation, the maintaining of impartiality and avoiding bias when treating patients. Then there is a need for professional integrity. Nurses need to maintain their professional integrity when dealing with victims or suspects of crimes. How do a nurse conduct physical examination and interview on his patient? You conduct a comprehensive analysis from the head to toe or from the toe to head of this patient, making sure to document all signs of injuries that are linked to the incident, regardless of the severity. Can make use of a body map or a wound chart to ensure that every part of the body is meticulously recorded. Hidden bruises must be recorded, and all evidences, including the vital signs, must be recorded and documented. Then the nurse needs to urgently attend to the patient need if there's a need for medical attention. The nurses need to collect information from the transport personnel and also interview them about the type of attack. Then there needs to be coordination in care of patient. The patient should have a prior knowledge before examination. And nurses also need to be aware of cultural issues. And these are issues relating to maybe gender preference, the need for allowing a friend or relative during investigation, and other cultural issues. So how do we assess risk? There are three main methods which are used. It could be the acquired procedure, the unstructured clinical judgment, or the structured clinical judgment. And regardless of the nature of violence, the same method are used for risk management. This involves gathering of information, identifying present and relevant risks and protective factors, offense analysis and risk formulation, scenario planning, preparation of the risk management plan and relapse plan, the presentation of findings and feedbacks to the patient, then updating of the risk assessment. The characteristics that are needed are basic principles of evidence collection. A forensic nurse needs to understand the principle when documenting findings. Then they need to be able to accurately represent their experience and expertise, especially during judicial proceedings. The forensic nurse needs to clearly differentiate between their theoretical training, the skills that they need to acquire, and the need for continuous education to remain current in their practice. We have two forms of model for the nursing care. We have the 3-column format and the 4-column format. The 3-column format has the diagnosis, the outcome, and evaluation, then the intervention. While the four-column format has the diagnosis, the goals, the outcomes, the intervention, and evaluation. And we need the mental health legislation when dealing with patient. And why is the need for this? This is to evaluate the nurse competency, then to ensure that patients' rights, like their access to legal representation, is being enforced, then to ensure protection of the privacy and confidentiality of patients. Working with different offenders, like an adolescent patient. When a forensic nurse is dealing with an adolescent patient, they need to approach treatment with sensitivity, establish trust and rapport with such a patient, then educate them on their rights, protect their privacy, and other legal obligations. When dealing with a psychosis patient, the forensic nurse needs to build a trust with such a suspicious patient. Then you need to understand the defensive patient's behavior. Increase your support and care for patients with depression. Dealing with a patient with a learning disabled offender, you can make use of methods like the disinstitutionalization, recidivism, use of resettlement option. And when dealing with a personality disordered patient, the clinical process comprises numerous steps and phases while observing the patient's mental condition. There's something we call the psychosocial intervention in forensic nurse, and these are processes that leads to the offense. So you need to analyze the factors that contributes to the offense that is not and which is not feasible until the patient's mental state is stabilized and it is clear that the patient can handle processing of information. There's need to monitor the mental state of the patient, and there's need to examine the patient's history and background to understand the dynamics of the offender and develop intervention strategies. What are the key issues that should be addressed in sociality for forensic nurses? A forensic nurse needs to understand the mental health status of his or her patient. You need to understand the cultural difference between different populations. You need to be able to communicate effectively with your patient, then maintain balance and develop social skills to ensure proper reintegration of such victim into the society. There's a system and organization dynamics in forensic nursing. This includes the interdisciplinary and disciplinary collaboration between different other disciplines, the forensic nurse, the police, the judge, and all other disciplines. There's the hierarchical structures, there's the role and the role players. That is, what is my duty? What is my own role as a forensic nurse? What are those things that I should do and things I'm not concerned with? Then how do you manage your resource? What are the additional trainings and education that I need to obtain to be to practice as a forensic nurse? In conclusion, there is a huge scope for forensic nurses, and this includes crime scene investigation, we have the forensic pathology, investigation of deaths and correctional settings, the forensic psychiatrist. Most times, forensic nurses have the reliable source of evidence which can help to lead to few crime scene error and higher conviction rate. And this is due to their direct contact with the victim firsthand. Thank you for listening. Hope to see you in the next class.